Good afternoon, Chairperson and respected colleague. I am presenting results of early return of function in angular deformity correction after growth modulation with using 8 plate and PET screw. Correction using hemifasciidosis with 8 plate and PET screw is a popular minimal invasive return to function method for correction of uniplanar deformity. Delay return to function has been previously reported after growth modulation surgery by the Fillingham in 2014, but exact time for return to school and sports had not been studied. Aim of our study was examine the return to mobility, day-to-day activity, return to sports, school in children who underwent growth modulation surgery. This is a retrospective study. 50 patients underwent growth modulation surgery, 22 male, 28 female. 50 patients out of 50 patients, 19 underwent 8 plate and 31 PET screw. We have recorded the following activities, that is day to day: stair climbing, squatting, sitting cross leg, going to school, fast walking, running, and participate in sport. We use one score for pain. 0 is no pain, 10 is maximum pain. Results at 4 week. At 4 weeks, 3 out of 19 patients had the pain in 8 plate group, while 2 out of 31 patients had the pain in PET group. Active range of movement achieved by 4 weeks in 8 plate group was 102, while in PET it was 126.4 degree. Passive range of movement achieved by 4 weeks in 8 plate group was 120 degree. In PET group it was 130. Active and passive full range of movement achieved at 12 weeks in 8 plate, while in 9 weeks in PET group. Extension lag at 2 weeks in 8 plate group was 16.6 degree and 8 degree in PET group. Extension lag was disappear 8 week in 8 plate and 4 week in PET group. Ambulation on day 3, only 2 patients out of 19 patients able to walk independently in 8 plate, while 13 out of 31 patients in PET group. By the 2 weeks, 17 of 19 patients able to walk independently in 8 plate and 30 out of 31 in PET group. Stair climbing, sitting cross leg was achieved early in PET group compared to 8 plate. Squatting was the only achieved early in 8 plate group. Only sitting cross leg was show the significant p value. Almost stair climbing in 12 weeks is 90% in PET. Going to school, rapid walking, running, return to sport was achieved early in PET compared to 8 group. Conclusion: ambulation and mobilization start early in PET group compared to 8 plate. Return to sports activity early in PET group than 8 plate. Going to school, rapid walking, running was early in PET group than 8 plate. Squatting was the only achieved which early in 8 plate compared to PET. The rate of correction was faster in PET than 8 plate. This is a retrospective study with limited sample size. The study has sustained to be the first report comparing PET versus 8 group, return to mobility, day-to-day activity, and return to sports and school. It's a very good paper from JPO 2021. At 1 month following the 8 plate, 65% had not returned to their prospective activity level, with 38% still required pain medication. Patient and parents should be counseled that there is a significant activity limitation and pain level for a month or longer duration. Another paper from JCO 2015, delay of return to function dramatically affect the pediatric patient, causing unnecessary absence from the school and strain on the care gear. The use of the immediate post-operative physical therapy statistically significantly helped to return the activity. And